Okay, I think we've started. Um, Good morning, everyone. Really lovely to be able to see you all. Thank you for joining us for the webinar today. And as you will have seen on the registration, this is a introductory webinar specifically for AMRC charity staff and beneficiaries of AMRC charities as well. And it's all about Health Open Research, which is a platform launched in partnership with the AMRC. So I'll cover a bit about the agenda on the next slide, but this webinar today is essentially to provide an overview of the platform, how you can submit your research, and also give you the opportunity to ask us any questions that you might have. And quickly to introduce ourselves, there's a few speakers today, and when we come to each of us, we can also provide an introduction. But I'm Becky Hill. I'm Head of Open Research at Taylor and Francis, and work closely with our F1000 colleagues on Health Open Research. And I'll be co-presenting alongside a few of my colleagues today. And I'm not going to read out all our bios because that will take us a bit of time, as there's lots to say, but you can see all the bios on the event page as well. But just to go through in order of the speakers, Holly McConnell is the Research Policy Officer at the AMRC and focuses on responsible funding policy. And Holly will be presenting shortly on the background of Health Open Research and why the AMRC chose to be a co-founder of the platform. We'll then hear from my colleague at F1000, Dahlia Williams, who's the Associate Publisher, and is going to talk us through the F1000 and Health Open Research submission process. And at the end of the presentation as well, there'll be a QR code that you can scan if you want to book a short chat or meeting with Dahlia to talk through a submission that you have in mind. So please do have your phones ready at the end if that's something that you'd like to do, or we can put you in touch. And then last but not least, we will hear from Vanessa Gordon-Jayagu from the World Cancer Research Fund International, who's going to provide an author perspective on a recently published paper on Health Open Research. And we have a gateway on the platform with the WCRFI. And so Vanessa will be able to talk through some of the publications that we've recently published on that. So we've got quite a full webinar for you all today, and there'll be lots of time for questions at the end as well. And we're going to, as I said, cover quite a lot of ground. And this is broadly what we'll cover. So we'll start with an introduction to open research more broadly, a bit of context and background. I'm not going to spend too long on this because I'm sure this is an area that lots of you are really familiar with. I'm then going to move on to a bit of the background and aims of Health Open Research, why we set it up. And this is where Holly will come in to provide some context and background on why we established it and how it's evolved over time. I'll talk through the underpinning open research publishing model, which operates on the F1000 model as a publisher. It operates quite differently. Some of you may be familiar with it, but in case not, we'll talk you through the process from submission through to publication, peer review, and indexing as well. We can also publish a variety of peer-reviewed article types and non-peer-reviewed article types as well. And so we'll give a bit of an overview of some of the things that can be published. And I'll then pass over to Dahlia, who'll talk through the submission process in more detail and walk you through kind of some of the checklists and things to think about if you're wanting to submit a paper. And as I said, there's a QR code at the end of the presentation that you can scan to book a meeting with Dahlia if you'd like to. And then finally, as I mentioned, Vanessa will provide that kind of all-important perspective from an author who's recently published a peer-reviewed article and non-peer-reviewed documents as well on Health Open Research through the partnership with the WCRFI. And then we should have lots of questions at the end, lots of time for questions at the end, where either you can raise your hand, ask a question, or there's also a Q&A box, I think, or the chat that you can put questions in as we go and we can pick them up when we get to that point. But also, we're a friendly bunch, so feel free to get in touch with us after the webinar as well if you have any questions after we finish today. So on to the first section, with a bit of quick context on open research. You'll hear a lot of this term throughout the webinar, and so I don't want to assume anything, but just to kind of define a little bit by what we're meaning when we talk about open research. So lots of you will hear this, will have heard this in many different contexts, and whether it's open science or open research or open scholarship, which are terms that we'll be using interchangeably really throughout the webinar, which at its core is about making academic research freely available to everyone, including the public, which we know is a very important facet of AMRC and the many member charities that are part of it. So lots of you will be aware of the move to open access publication in recent years, whether that's through funder mandates or various other avenues or policy imperatives, and the shift away from a more traditional subscription journal where articles sit behind paywalls. And open access is a really important part of open research, but definitely not the whole picture. It's just one component part. And so open research really goes beyond making just the final research article, the narrative overview openly available, but it's really about introducing transparency across the whole process, whether that's sharing research data so others can verify and build on your research, making research methods as clear and reproducible as possible, and also opening up the communication around research so things like peer review reports are transparent and publicly available as well. But also things like posting preprints, so findings can be shared at a really early stage without delay. So these are all kind of encompassing factors of open research when we're talking about, throughout the rest of the webinar, a kind of open research publishing model. And we know that this is not a new thing. Many of you will be very familiar with this already, and you probably joined this webinar because this is an area that you're interested in. And we know that there's growing support, whether it's from institutions or funders, for open research and open science ways of working. An F1000 model very much encompasses all of those elements, which you'll hear when we talk through kind of the publishing model in more detail later. And just to kind of acknowledge that it's not just about compliance, I think sometimes open science and open access can feel like there are mandates in place and we have to kind of tick these various boxes. But actually, it's kind of worth reflecting on the many benefits for researchers and for authors in participating in open research, as this infographic shows. And I'm not going to talk through everything on this slide, but just to pick up on a couple of examples. For example, the greater transparency in the research and review process. If you're talking about open peer review, that can mean that often open peer review reports are more constructive as they're aware that there's more scrutiny on what's being written when it's open, but also that reviewers themselves get credit and recognition for the work they've done, which often is largely invisible work in a traditional peer review workflow. Also, many studies have looked at the increased visibility and also the potential citation impact of making research accessible to a wider audience. And also, I think a really important example in this context, where making more types of research public, and we'll come to this in the kind of diversity of article types that the platform offers, whether that's null and negative results or kind of different types of research outputs, helps to bring greater efficiencies within the academic community. It means other researchers know more about the work that you're conducting in the field, and likewise vice versa, and are less likely to kind of repeat experiments, which also in turns kind of reduces research waste, enables more sound and rigorous ways of sharing research. And I think a really important part as well is the kind of opportunity for greater collaboration, both in enabling kind of visibility of your own work, but also having that in-depth knowledge of what others are doing in your community as well. So that's kind of all I'm going to say about why we're focusing so much on open research in this context. And then I'll move kind of swiftly on to health open research itself. And so with all of the kind of tangible benefits of open research that I've just very briefly spoken through, the AMRC wanted to establish this open research platform that really kind of led by example in terms of what open research could look like in a publishing model, allowing for researchers to share their work, collaborate with others, and also gain as much recognition and visibility as they can through publishing. So in collaboration with us, F1000, we launched Health Open Research in a previous iteration in 2019. And I'm going to pass over to Holly now to kind of talk through that background and context from the AMRC's point of view.
Thanks very much, Becky. Hi, everyone. I'm here today as Research Policy Officer at AMRC and as a lead at AMRC on our work on open research to talk to you a little bit, as Becky said, about the background of why AMRC and our co-founding partners decided to set up the platform. Can I have the next slide, please? Thanks very much. So as one of the founding partners of Health Open Research, we wanted to tell you about the platform, why we developed it, and how it's a great resource for AMRC members. And so I thought first we'd give a bit of an introduction to who we are, which I appreciate many of you will probably already know, but just in case. AMRC was founded in 1987 by a diverse group of medical research charities with an aim to unite the sector and provide it with a leading voice. Over the past 35-ish years, we've grown to have over 150 members, and we summarise our purpose under 3 headings. We champion our charities and tell their collective story, advocating for a thriving research environment that facilitates innovation and improves health for everyone. We connect our charities so they can share learning and collaborate, opening up opportunities for them to partner with each other and others from across the research system. And we support our charities to fund research as effectively as possible and to provide a kite mark of quality. We help them, hopefully, to navigate a changing landscape and be on the front foot. And this huge network of charities carries heavy funding weight. In 2023, AMRC members invested 1.7 billion in medical research, and this enabled nearly 200,000 people to take part in AMRC charity-funded clinical trials or studies. And that's a massive number, and it makes an enormous difference to saving and improving lives through medical research. Next slide, please. We just hovering. Could I have the next slide? Perfect. Thank you so much. So we have an incredibly diverse membership of over, as I said, 150 members, and we have a further 16 introductory members, ranging from the biggest players in the sector, like the Wellcome Trust and Cancer Research UK and British Heart Foundation, all the way to smaller charities focused on a specific area or rare disease, and everything in between. Next slide, please. AMRC produces guidance for our charities on how to fund responsibly. And this covers a range of different topics, from the use of generative AI, reducing bullying and harassment, to EDI, and patient and public involvement, and it also includes open research. As Becky already touched on, publishing research under the traditional landscape and model of publishing can take a long time. It can lead to work not being published at all, and it can trap research behind expensive paying walls. Open research promotes scientific collaboration and reduces research duplication and waste, allowing charities, their supporters, and their beneficiaries to advance research progress more quickly and gain real-world research impact. Open research creates a richer research environment and helps to advance science broadly. And open research also supports other important areas like research culture, career development, and research assessment to improve research careers. Open research is becoming increasingly important to funders, policymakers and researchers. For example, Plan S, an initiative for open access publishing, was launched in September 2018 by an international consortium of organisations, including research funders, and it requires that scientific publications from research funded by public grants must be published in compliant open access journals or platforms. There was also the Declaration on Research Assessment, which was a worldwide initiative to improve how researchers and the outputs of research are evaluated, and that was established in 2012 to stop the practice of judging scientific output by its journal impact factors. Many funders in the UK and globally, including Wellcome and NIHR, the National Institute for Health and Care Research, support open research principles. Wellcome and UKRI are a member of the Plan S consortium and are also supporters of DORA, and Cancer Research UK is also a DORA supporter. With recognition of the importance of open research growing, we wanted to support our members to be at the forefront of this movement. Next slide, please. Open research is particularly important for medical research charities that rely on public donations and have a duty to their donors and stakeholders to be transparent about how that money is used. And alongside our guidance supporting members to fund responsibly and openly, we wanted to provide a practical tool. that complemented that guidance and supported our members in implementing those recommendations. So in 2019, we and 24 of our members launched a platform to support members in sharing research results in a transparent and accessible way. And this platform was initially named AMRC Open Research, and it was open to researchers from these founding charities whose logos you can see on this slide. Next slide, please. Thank you. So from its founding as AMRC Open Research to its existence today as Health Open Research, a global open publishing platform open to all researchers, AMRC, we, our members, and F1000 have continued to use the platform to further transparent practice. Following its launch in 2019, 2 years later, in 2021, AMRC Open Research opened to submissions from researchers funded by any AMRC member or any AMRC supporter organisation. And then in 2022, the platform was relaunched as Health Open Research, as we know it today, and open to submissions from researchers funded by funders outside of AMRC's membership, from global funders and global universities. And other research organisations. In 2024, the platform was indexed on PubMed Central, and all published articles are now indexed on passing peer review on PubMed Central, as well as appearing on Google Scholar. And this year, in 2025, the platform is still growing. To improve the transparency of Health Open Research outputs further, we recently introduced a requirement for plain language summaries to be included in research articles submitted to the platform. Health Open Research offers many benefits for researchers. By simplifying the publication process for charity researchers and offering a 15% article processing charge discount for AMRC member beneficiaries and AMRC member staff, Health Open Research aims to save researchers valuable time and money. And this means more time and money can then be spent carrying out vital research to improve the lives of the communities AMRC members support. The Health Open Research platform enables researchers to publish any research output, regardless of novelty or outcome, including confirmatory, replication, and negative or null result studies, allowing researchers to also share their whole portfolio of work. Thanks very much, everyone, for listening, and looking forward to hearing about all of the other speakers today speak about their experience with Health Open Research.
Thank you so much, Holly. Brilliant. So I think we've laid the groundwork of why Health Open Research is what it is today and how it's evolved. And the next bit of the presentation, I'm just going to talk in a bit more depth about the platform itself, the scope, how the publishing process works, and then pass over to Dahlia for kind of the submission process. So you've got a good sense so far of kind of why we set up an open research platform in this subject area and how it's relevant to the AMRC's aims and strategies and ambitions as well. And that really brings us to kind of where we are today with Health Open Research, which is that global community, a space for global community of researchers working in medical health and social care. And as Holly said, it's broad scope and sound science as well. So we're publishing a real range of research outputs to enable the dissemination and discoverability of research that's open, accessible, and usable and reusable as possible. And we really want that to be reproducible as well. So we're not kind of screening for perceived novelty or impact. So that's where the kind of null and negative results come in as well. And I'll talk through the kind of open research publishing approach later and how that model works, because it is quite different to a traditional journal. And as Holly said, it supports that kind of shift in research assessment, offering a diversity of research articles, again, which I'll talk through in more detail. And we really see it as an inclusive venue supporting researchers across disciplines, career stages, and kind of recognising team science, but also that focus from supporting research into policy and practice through the variety of article types that we have, but also the plain language summaries mandate that Holly mentioned as well. So Health Open Research, I'll cover the scope very briefly on the next slide, but it does encompass kind of all stages of the research process. And as the subtitle here suggests, cause, cure, and care, kind of building on understanding of underpinning research, development of treatments, therapeutic interventions, improving diagnosis and detection, risk reduction, prevention, the whole kind of gamut. So any research that you're doing within AMRC charity contexts, I'm sure would be relevant. And I'll not spend too much time on the scope because you can find this all on the platform itself. But as I mentioned, it's very broad. It's all basic scientific, translational, applied, clinical research, both quantitative and qualitative studies as well in areas of health and disease, multidisciplinary, interdisciplinary, the whole gamut. So, oops, sorry, moved my slide too quickly there. But as I mentioned, we've got plain language summaries for all article types, but also, given the important aspect of the public and patient-facing aspect, also the option to include patient and public involvement statements on articles as well. So really kind of making the research output as clear and translatable as possible. So that's the scope and kind of where we've come from, and we can answer more questions about the aims and scope later. But I want to give a good amount of time to the actual publishing model it's clear kind of how that works. So as we mentioned before, the F1000 model is really encompassing all aspects of open research. And this is what all of our platforms are built on, including Health Open Research. So it kind of is comprised of these 4 core elements, which I'll talk through here. Open access, including permissive licenses, CC BY licenses in the most part, to ensure that all the research can be visible, accessible, and discoverable. We have a strong open data policy, which is very much under that proviso of as open as possible and as closed as necessary. So data will be shared in a repository and linked. It will be under a CC license and linked to the article through a data availability statement. We offer a range of article types, which are designed to open up the whole research process, both peer-reviewed and non-peer-reviewed. And the open peer review aspect, the peer review aspect is undertaken openly as well. So open identities and open reports, really designed to enable integrity, transparency, and trust. So these are kind of the real core open research elements of the publishing model. And this slide, there's a lot on here, but I'm going to talk you through kind of the actual publishing process, because this is where we differ from a traditional journal. So Health Open Research and any of the publishing platforms built by F1000 are underpinned by this unique scholarly publishing model, which is designed for open research. And basically we do everything any other journal or scholarly publisher would do, but in a slightly different order to really maximize the potential for use and reuse of research. So if we start at the left-hand side of the screen, this process begins with an article submission, as with any other journal or publishing platform. And at that stage, our in-house editorial team will do a few key checks to assess the author eligibility, the article scope, and check for plagiarism as well. So kind of very basic checks. And if all of those are okay, it will then proceed to a rigorous set of pre-publication checks. And these are really important because of the way that we publish. We publish before peer review, and I'll get to this. So we want to make sure that everything that we publish is really rigorous and sound. So we have a very robust set of checks at this stage before we publish an article. And these are made up of really comprehensive checks on things like reporting, ethical guidelines, checks for data availability, and also supporting authors making their data and software open and in line with the FAIR principles, so it's findable, accessible, interoperable, and reusable as well. And these are really extensive checks that go beyond the types of checks that you might have found on preprint servers, as an example, which is a kind of comparable process that you could liken this to at this stage. And it makes sure that, as we mentioned, every article has a data availability statement linking to the underlying data, unless there are exceptions, of course, which we've got a list of that we can look through that our editorial team can advise on as well. So then we get to the third bubble on the workflow here. So if at the stage and when an article has passed those rigorous pre-publication checks, it will then go through the production process where it's converted to kind of text and data mining format, so PDF, HTML, XML. Proofs and editing are conducted, and we do quality checks on citations, references, image resolutions, any multimedia, so ensuring that everything is kind of up to par on that point. And then once that's done, we'll publish it. So there's quite a lot, as you can see, that happens between submission and publication, but it's a relatively short space of time because it's before peer review. And once it's published, it's a fully citable publication. It has a DOI, it's indexed in Google Scholar, but it's not indexed elsewhere because it hasn't been peer reviewed at this point. But this is the really quick part of the process. We help to get research out there, before the peer review process happens. But obviously we want to verify and validate that piece of research then. So at this stage, our post-publication open peer review model begins. And we at F1000, our editorial team, will invite expert reviewers according to the kind of remit of the article. And authors are welcome to suggest reviewers in the submission form, but it's not a mandatory step as well. And we'll also screen those for kind of potential conflicts of interest, etc. But we'll invite the kind of appropriate reviewers that we can find. And as I mentioned before, the peer review, the peer review process is completely open. So if the reviewer accepts the invitation, their review report will be published openly available alongside the reviewer's name and affiliation. And I've got an example of that in a few slides, so you can see how that looks on the platform. And then this is a really kind of iterative and interesting part of our process, because once the peer review reports have been loaded and are on the platform, the author will be notified that the review report is there, and they'll be invited to respond to the report. Any comments or changes that they make are also clearly documented and published, really making the process as transparent as possible throughout. So as I say, this is a really iterative process where multiple versions of the article are created as the article evolves and as part of the peer review process. And all of the versions of the article are independently citable, but the article is very much a living document, and the process is really intended to be as collaborative and constructive as possible. And any readers are always directed to the latest version of the article, but they can look at earlier versions if they like. And then reviewers, in turn, can continue to update the assigned article status and review reports as the article evolves and the authors kind of amend the article in line with comments. And we have a peer review threshold, which I'll talk through on the next slide, which is according to the status that the peer reviewers give. And once it's past that peer review threshold, and as Holly mentioned, we refer to this as passing peer review, the article will then be sent to the relevant article abstracting and indexing services that we work with. So PubMed, whatever that might be. And this is kind of when it's positioned as the version of record article, further kind of increasing discoverability and reach of the article. So that's kind of the end-to-end process, which combines the kind of benefits of preprinting and the speed of sharing that preprinting enables with that quality assurance of peer review in one publication journey. So that's kind of how any peer-reviewed article that you submit to us, that's the journey that it will undertake. And I'll just go into a bit more detail on some of these on the next slides. So this is an example of the various peer review statuses that reviewers can assign to an article. And an article is considered to have been sort of sufficiently peer reviewed or it passed the threshold when an article's received 2 peer review reports. And if an article's not passed peer review at this stage, as you can see, the version 1, they've got a question mark and a cross. They'll then be asked to provide a second version, and there'll be further review reports required. So basically, as soon as an article receives 2 ticks or 2 approved statuses, that's considered passing peer review, or 2 question marks and a tick as well. And the article will continue to evolve until it gets to that threshold. So as you can see, the second version has passed peer review, and the first version, there's a further revision required. And this is an example how the kind of open peer review panel sits alongside the article itself. And this is actually Vanessa's article that she'll talk through later, which I think is a nice example of the open peer review in action, where you can see how the article evolved in line with the reviewer comments. You can see the names of the reviewers below, and if you click on the actual icons of the statuses, you can see their review reports. So it's a totally transparent process. And you can see here that the article that we're seeing is the version 3 version of the article, whereas if you click through to other versions, you can view those as well. And an author could, in theory, keep kind of producing multiple versions of their article, but you probably aren't incentivized to once it's past that peer review stage. It's really up to you. And I think the really nice thing about this is that you can see this examples on all of the articles online. So I think the other benefit of there being an open peer review panel alongside an article is that for early career researchers, when they haven't conducted peer review before, this is almost kind of a mini training package of how does peer review work in practice when these things are often behind closed doors. And I think the other nice thing about the transparency that's enabled here is that it enables recognition of co-reviewing as well, where we know that often early career researchers, postdocs help in the peer review process, and that just isn't recognised or credited in any way. Whereas what this enables is that you can list a co-reviewer as one of your as one of the reviewers. It really shows exactly who's contributed and giving that credit and recognition where it's deserved. But also you can see metrics on an article and any version of the article as soon as they're live. So you can see the views, the downloads, and also any altmetric scores as well. And actually the peer review reports themselves have DOIs citable, and you can also see metrics on there. So it's all very kind of visible and transparent. And this is a bit more of a zoomed in version of the article metrics that you can see on any article. And this is, anyone can see this. This is not a kind of a version you have to sign into, but you can look at the downloads, you can look at the citations, how many times it's been picked up on Twitter, the countries that are accessing it, cumulative views, etc. So it's all quite open and available for everybody. So that's the process in a nutshell of submitting your article. There's just 2 more slides from me on the kinds of articles that you can submit, the kinds of research that you can publish on Health Open Research, and then I'll pass over to Dahlia. So as I mentioned, and as Holly mentioned as well, Health Open Research offers quite a unique range of article options and a real diverse range of outputs that researchers and authors can publish with us. And it's really designed to enable researchers working across career stages in large and small teams to publish research from all parts of the research journey. And we've developed these articles over time in collaboration with our partners and also in response to the evolving needs of research and science more broadly. And we're regularly reviewing and adapting these article options to really make sure that it meets the needs of science and dissemination and sharing today. And Health Open Research offers over 20 article options, and these are all peer-reviewed article options, which you can see kind of listed around the research lifecycle there, which include things like case reports, case studies, clinical practice articles, data notes, method articles, software tools, study protocols, systematic reviews, and of course, kind of the research article as the more traditional format. And the reason that we're providing all these article types is to enable researchers and provide them with the ability to share and publish all parts of the research journey, and also no matter what the result is. So as Holly mentioned, including negative, null and incremental research as well. And the idea as well is to kind of present the opportunity to link these outputs together as well through a sort of threaded approach, which helps tell the story of research and help funders and sponsors of research kind of understand what has worked and what hasn't as well. And these will all go through that process that I mentioned before of that post-publication peer review and versioning. And we also publish a variety of research materials which aren't peer-reviewed, which are often kind of termed kind of grey literature or documents, whatever that might be, which we know are incredibly important outputs of the research process, but often kind of not given the recognition that they deserve. And what we wanted to do is really elevate the status of these types of outputs and recognise the importance of them providing a publishing route. So these won't undergo the peer review process, but they will, you can publish these on the platform where they'll get kind of metrics and people can comment on them as well. And it's really, again, recognising that lots of this research has little credit that is done, are recognised for the work that's done in this area. So we really wanted to kind of enable a route for this to be shared. And Holly mentioned DORA earlier, the Declaration on Research Assessment, and recognising a more holistic view of research outputs. And this is very much in keeping with that, really facilitating that route for researchers to share all parts of the research process. And as it's mentioned here, it gets a DOI, it's not peer-reviewed, but it's published open access with open licenses. It's got usage metrics. So it is really seen as a publication in its own right with the kind of metrics associated with it. So that's quite a quick walkthrough of the publishing process in and of itself and the types of things that you can publish with Health Open Research. So I'm going to pass over to Dahlia now, who'll talk you through kind of, if you're thinking about submitting, some of the steps and checklists that you might want to think about before we pass to Vanessa for her perspective as author very recently, and then we'll open for questions. So Dahlia, over to you first.
Thanks, Becky. So I'm just going to, as you mentioned, give a bit of guidance on preparing your research for publication on the platform, specifically passing our pre-publication checks, which are quite extensive. Looking at our submission checks here on the screen, firstly, we will check that your work is original and hasn't been submitted to any other journal, though we do allow submission to preprint servers, as most traditional journals do as well. We'll then check the reported study meets all required research and publication standards. So that will also include ethics statements and reporting guidelines for certain article types like systematic reviews, for example. We'll also check the methods section has enough detail and also that all relevant data are made available, either within the article files or linked within the article to a public repository. And I'll speak a little bit more on data on the next slide. We'll also check that authors understand the unique publishing model of the platform. So we'll have it on the submission form to make sure, sort of as a checklist, that you are aware of specifically the post-publication open peer review process, which is obviously very different from other journals. And we'll also do extensive checks on authorship. So we'll look at author names, affiliation, ORCIDs. Also author contributions need to be listed in the manuscript, and funding and conflict of interest statements as well. So moving on to data. So open data is one of our main requirements and can be a barrier for publication for a lot of authors. We require all articles to have an underlying data statement and suitable data deposition, and that will include either raw data generated from your own research or source data that's generated by you, but not generated by you, but still used in your work, for example, using archival resources. And we will make sure that underlying or extended data is deposited in an approved data repository like Zenodo, Figshare, or Dryad as well. And our editorial team will help you as much as possible during the pre-publication checks to deposit your data. And we do allow for certain exemptions with regards to sensitive data, a lot of the time sensitive human data. And you can find more information on data sharing on our website. And you can also just speak to our editorial team. You can do it before you even submit, just to ask about sharing data if there's anything sort of potential issues in doing that as well. So also just wanted to mention the community gateways we have on the platform. Gateways are basically hubs for partner organizations to compile and promote their work on the platform. And if you are funded by any of the charities listed here, you should be able to submit to their community gateways, which will give you more visibility for your work and just sort of integrate you a little bit more into your community with the charity as well. And all research funded by an AMRC member charity is eligible for a 15% discount on our APCs, as I think Holly mentioned. So if you add this to both the funding statement on the manuscript and also on the submission form in the notes to editorial section, you should be eligible for this discount for publication as well. And finally, I just wanted to show where Health Open Research is currently indexed. So papers, as Holly mentioned, are indexed in Google Scholar immediately after publication and before peer review. And then once they pass peer review on the platform, they'll be indexed in the directory of open access journals, PubMed, Dimensions, Top Factor, and Open Alex. And I think that's it from me. But as Becky mentioned, please do feel free to email me or book a call with me if you're interested in submitting or have any questions about the submission process. I think my QR code will be put up later, and I'll also put my email in the chat. Thank you very much.
Thank you, Dahlia. So, Vanessa, over to you on perspective from an author.
Thanks, Becky, and good morning, everyone. As mentioned, Becky and I worked together to set up the World Cancer Research Fund International's Community Gateway, as well as publish several of our research and policy outputs with Health Open Research. And because of this, Becky invited me to briefly talk at today's webinar about the author experience. I just thought it would be kind of useful to briefly introduce WCRF. We're a network of cancer prevention charities, and through our Global Cancer Update Programme, as well as our other research, we examine how diet, body weight, physical activity impact the risk of developing and surviving cancer. Our research is used to inform our cancer prevention recommendations. We also provide information for the public and produce outputs for policymakers and researchers. Because of all of this work, it was felt that having a community gateway with Health Open Research would be a good way for us to share our work with a wider audience. Working with Becky and setting up the gateway was really a kind of very straightforward process. We simply provided top-line information about WCRF, and that includes the picture that you can see running along the bottom, and information about the publications that we had already mentioned with published with Health Open Research, so that they could be added to our gateway once it was set up. The next slide, please. In terms of publishing with Health Open Research, this process is also incredibly straightforward. This is particularly true for documents once our gateway was set up. Copy can simply be uploaded and alongside the required additional information. And then the document, as mentioned, is checked by Health Open Research and assigned a DOI and published kind of without peer review. For paper, as mentioned earlier, for papers, the overall process is similar to publishing with other journals, but I felt that there were a couple of things that did feel quite novel, and some of these have already been mentioned by Becky, but I'll just go through them from kind of the author's perspective. Firstly, once a paper's uploaded to the system and after the in-house check, papers are published compared to more traditional publishing quite quickly and before peer review. We, as seen from our paper that Becky shared, you need to receive 2 reviewer approvals to pass peer review. And from a quick scan of published papers on Health Open Research, most seem to go through a couple of rounds of review before receiving full passing peer review. The second big difference is that the reviewer information and feedback is publicly available alongside your paper, and this feels kind of very communicative compared to more traditional ways of publishing papers. Finally, if new versions of the paper are needed to address review comments, all versions of the paper remain accessible to the public alongside each round of reviewer comments. This open communication between author and reviewer is quite different, and it does mean that you have the potential to sort of tailor your responses to particular reviewers if you kind of choose to do so, if you choose to look at their backgrounds, and there might be things that you think they would want to see compared to a different researcher, for example. And just to kind of close this section out, for WCRF, the benefits of our gateway and publishing with Health Open Research are that we're able to share sort of our outputs and information with a wider audience. And these might be people who wouldn't necessarily go to our website or who wouldn't read a specific scientific paper. We're also able to publish things very quickly compared to more traditional publishing. And we're also able to publish outputs from WCRF affiliated colleagues all in one place. As Becky mentioned, we're getting more and more kind of publications put on to our gateway, and it's a really nice way of just having everything all in one place, and we can, people can go there and see what's new as well. A key benefit is we can publish documents that don't fit the mold of traditional manuscript publishing, and that all our outputs get a DOI for ease of referencing. Next slide, please. That's really it for me. Aside from one last bit of promotion of the publications WCRF has available in our gateway, as you can see, we're beginning to build up quite a bit of a catalogue, and this includes technical reports. So we recently published 2 reports based on our work related to diet, nutrition, physical activity and body weight for people living with both colorectal cancer and breast cancer. We've also put up a CUP Global Framework, and that's from our mechanistic work. as well as sections of the third expert report that came out in 2018. That report's available on our website, but obviously here we're able to reference it and have DOIs for that work. And as Becky mentioned, we have 2 peer-reviewed papers, the first of which is mine. And so I was the kind of person who responded to the reviewer comments and all of that kind of stuff. And I found personally the process to be very straightforward. And it was new to have it all be so open, but actually it was an interesting process to go through. And I actually now quite like it. And I think that's it from me. So thank you. And as others have said, let us know if you have any questions.
Thank you so much, Vanessa. That's really helpful. I think it's very valuable to have a perspective from an author. So you're not just hearing from the publisher on how the process works. Thank you so much. So that's it from us. I'm going to leave this slide up for a little while because it's got the QR code that you can scan if you want to book a meeting with Dahlia, if you want to kind of discuss a submission that you're thinking about. It'll take you to Dahlia's Calendly site, so you can actually book a time slot with her if you'd like to. But whilst anybody's doing that, I'll open for questions. I can't actually see the chat if there's any questions in the chat. So Dahlia, maybe if there are any there, you could let me know, or feel free to put your hands up and we can take any questions now.
There's nothing in the chat or Q&A at the moment.
Great, thank you.
Oh, actually,
well,
something's just come in. How much does it cost to publish on the platform?
Yes, we should have had a slide on that. So the article processing, we as an open access publisher, we charge article processing charges, and we have transparent pricing. So essentially the over 20 peer-reviewed article types that we showed you are categorized into kind of 3 tiers, and we have a APC for each tier. So the research articles are the more expensive, and then down to some of the articles that kind of require less processing or review from our side. So I will have a look, or Dahlia can maybe have a look on the website now, because I can't remember off the top of my head exactly what they are.
I've just put the link in the chat and also the diagram that we have. So for research articles, it's $1,643. That also includes methods, reviews, systematic reviews, clinical practice articles, case reports, opinions, and open letters. And then data notes, correspondence, genome notes are $937, so that's the cheapest ones. And then category B, $1,185 for study protocols, registered reports, software tool articles, research notes, and policy briefs.
Thank you so much for that, saving me there as a good question that I should have known the answer to. But yeah, I think looking at the website is the best place to find that information, and you can see the breakdown of the costs of that APC, so kind of exactly how much is proportioned on peer review and production, etc. Any other questions? Okay, unless there's anything in the chat or the Q&A, Dahlia?
No, there's nothing else. We
can probably close then at this stage, and I'll take that as we've given you all the information you need. So hopefully that's a good sign. But yeah, please feel free to get in touch afterwards if you have any further questions. You have Dahlia's email in the chat. And so if you're wanting to kind of contact one of us as well, we can put you in touch through that, or book a meeting with Dahlia and we can go from there. But this meeting has also been recorded, and we're going to share that with you all as registrants, so you'll be able to watch back as and when, if that's of interest and you kind of want to recap on something. So yes, please do let us know if there's any other questions. But thank you so much for making the time to join us today, and thank you to the other speakers. Greatly appreciate it, sharing your perspectives. And yes, give you all 10 minutes back. Thank you.
Bye. Thanks.
Thank you. Bye.
Thanks.